world. We explore what glaucoma is, why it is so dangerous, and what individuals and communities can do to protect their vision. Now, joining us to guide this very important conversation is Dr. Abang-Obi. She's a senior registrar at LASUTH. You're welcome.
Thank you. Thank you for having me.
This silent thief of sight, that I know that is how they refer to glaucoma, and I've been hearing that since 2014. What exactly is glaucoma for those who do not understand? Because it comes with no symptoms at all.
Okay, so yes, just as you said, glaucoma is the silent thief of sight. So now, it is an eye disease that is caused by a sustained elevation in the pressure within the eye. And over time, this pressure damages the nerve that carries information from the eye to the brain, and from the brain back to the eye, the nerve responsible for vision. Glaucoma damages this nerve, and left untreated can result in irreversible loss of vision. Yes.
When you talk about pressure, I know I said it earlier and you smiled.
Yes.
Does it have anything to do with having blood pressure, high blood pressure?
Okay, so just as the body has its own pressure, the eye also has, it's a globe, it's a compartment. So it's a closed compartment. So pressure can build within the eye. Okay, but this is maintained by a balance between production of what we call, there's a fluid that maintains the eye. Okay, so a balance between the production of this fluid and its drainage. So once there is that balance, the pressure never rises above. Okay, meanwhile, the normal eye pressure now is 10 to 21 millimeter mercury. That is the accepted normal pressure for the eye. So once there's an imbalance between production and drainage, the pressure begins to rise within the globe. So eventually it causes backward damage to the nerve. Left untreated, it results in damage to the nerve and ultimately loss of vision.
Okay, before we go to the lack of treatment or the treatment one has to go through, is this particular condition, it is not a disease, it's a condition of the eye.
Okay.
Is it hereditary? Is it something
Yes.
you inherit from your parents
Yes.
or some kind of family member?
Yes, yes. So family history is a strong risk factor for the development of glaucoma. So an individual with a parent or sibling with glaucoma is at higher risk of developing glaucoma than an individual who has no family history of glaucoma.
Okay, since it comes with no symptoms, how how do you now detect it?
So that is actually the menace, and that's the problem there, and that is why you have this World Glaucoma Week, to create an awareness. Yes. So because at the initial stages there are simply no signs and no symptoms. The symptoms and signs begin to show themselves in the advanced stages of the disease, and the sad thing is at that time any vision lost cannot be regained. Okay, so that is why we advocate for screening. Okay, once an individual is 40 years and above, we advise that whether or not you have any eye symptoms, just go have the eyes checked. That is the surest way to identify glaucoma early and institute treatment.
So once you have your eyes checked and you've been, diagnosed or told that, okay, or it's been confirmed that you have glaucoma, so what is the next step? What do you do?
Okay, so what we do is to try to manage the only modifiable risk factor, which is an elevated eye pressure. So what we do, the treatment options include medications in the form of eye drops, laser treatments, and surgery. There are different kinds of surgery for glaucoma. So all of these aim to bring down the pressure to a level where damage would hopefully not occur anymore in the eye. Yes, so that those are the treatment options available. And the goal is to bring down the pressure.
Okay.
Yes, some patients will argue that my pressures have never been more than 21, and that is the safe limit. But no, there's also a concept we call target pressure. That 21 may be enough to cause damage to the nerve in an individual, but maybe safe, a safe normal for another person. Okay, so once an individual is diagnosed, your healthcare providers would provide the best care for you, okay, in the form of eye drops, laser, or surgery.
Yes. Okay, for those who never went for any form of eye test for it to be detected and then you leave it, or for those who were told that, oh, you now have this condition and left it untreated, or or not, and left it not managed, what happens after that?
Okay, so we don't want anybody to, we advise everybody, our voice this week is to create an awareness. Okay, and I would like for you to use your channel to share this awareness. It has to go around to everywhere. Everybody must know that they should have their eyes checked, because the damage that occurs from glaucoma is irreversible. We have patients coming in that say at that point they are ready to do anything to have their sight back. And the sad thing is, when the damage occurs, it is not reversible. There is nothing we can do anywhere in the world to bring back vision that is lost from glaucoma. Yes. Yes, that is how bad it is.
Okay, I've also seen some people who say, oh, if you do this eye test, they will say you have to wear glasses. I don't want to wear glasses.
Please.
I know that is a misconception, so
yes,
I want you to clarify
please.
that.
Okay, so I was going to mention it, but thank God you brought it up. Not every eye condition requires glasses. Eyeglasses is not the solution to every eye condition. Okay, please, I need people to understand that there are a wide range of conditions that do not require glasses, and glaucoma is one of them. You see patients with glaucoma, they have gone to many hospitals, they have even been told that the pressure in this eye is high. Start using this eye drop, and they'll outrightly tell you, I've been told that if I start using the eye drop, I can't stop it. So I'd rather go with glasses. I want glasses. They will come with a bag full of different glasses. And I say, this is not the solution to your problem. You see that you have been using these glasses for a long time, 4 or 5 years, and you are still looking for another glass. So, patients need to be aware. Yes.
Okay, aside family history or family, what's it called now? Inherited it from your family, are there lifestyle or health conditions that can also, make you have the condition?
Okay, so aside family history, age is also another non-modifiable risk factor for glaucoma. Advancing age.
When you talk about age,
40 years and above. Yes, but mind you, glaucoma can occur in any age.
Can
even
it occur
babies.
in children?
Of course, yes. Even in children. There's the entity called primary congenital glaucoma. Like that, the glaucoma that starts happening right from in utero, before a child is born. Yes, please. And then there is the glaucoma that we also call the juvenile open angle glaucoma. It occurs in young people, less than 30, less than 40, in fact. Yes.
So the eye test is really, really
very, very important. Yes.
From whatever age, maybe from the age of 5 or
yes.
It's better you get your eyes
checked.
Checked at all times.
Yes.
Okay. Still talking about lifestyle or health conditions. Can you make it? Can you reverse glaucoma with with lifestyle or diet or just generally
unfortunately, no. No, there is no lifestyle modification that one
can
no,
please.
Reverse it. No, no. Please, no.
Okay. So what are some warning signs? Because you said something that, from the early stage to the critical stage. The early stage, you don't have any symptoms.
That's right.
When you get to the critical stage, is there some kind of feelings you have in your eyes?
Yes, there are symptoms.
What do you look out for?
Okay, so in the advanced stages of glaucoma, that is when one begins to notice a reduction in how much they see. Some patients describe their vision as being dimmer than before. Okay. Then some patients also notice a poorer vision at night. Normally, they can stroll out at night, you know, comfortably, but when they develop advanced glaucoma, they have difficulty seeing well at night. Okay. Then some patients also bump into objects in their paths accidentally.
With their eyes open?
Yes, please.
Even if the place is well lit?
Yes, yes. Yes, objects that a normal person with good vision can see. People with glaucoma will be bumping into them, you know, mistakenly. Then in some cases when the pressure is really high in the eye, some patients may have pain. Okay? All right? So, yes, they may also have headaches. The eyes may begin to water. Okay? And some may complain of seeing colored rainbows around lights. So this occurs usually when the pressures are really high within the eyes.
What about floaters? You
okay, no. Okay, no, that's a symptom
of
glaucoma. No, it is not. It's a symptom of a different eye condition.
Else? Okay,
yes.
I see a lot of floaters, though it has reduced from
treatment.
So I'm just trying to understand.
Okay, no, that is not a symptom of glaucoma. Yes.
God. Okay, because I thought it was getting worse.
No.
So I want to talk about the treatment more. You know, before we started, I told you about some kind of treatment I have been doing. Okay. So let's talk about the treatment now. Okay.
So the treatments, as I mentioned earlier, can be in the form of eye drops. There are a wide range of eye drops that we can use to lower the eye pressure. Okay. Then we can also offer laser treatment. Okay. It works by...
What does the laser treatment do?
Yes, it helps to create or open up the channels to allow for drainage of the fluid within the eye. Okay, yes, in a way to bring down the pressure within that globe.
Isn't that quite intrusive?
Ma'am?
Isn't that quite?
No. It's a non-invasive procedure done in the clinic. It's not a surgery.
Okay, it's not a surgery.
Yes. I know people are always scared, but no. It's a very good alternative to eye drops now. Yes, and then also a good alternative to surgery for people that are scared of surgeries. Then, yes, ultimately we have surgeries. There are different kinds of surgeries, but the gold standard currently is called trabeculectomy. So yes, that entails creating a channel within a part of the eye, still to allow drainage of the fluid, to prevent fluid buildup and then an elevation in the eye pressure.
What about the treatment I spoke about? What is it called? The one that you look into.
Oh,
is it a treatment or?
Okay, no, that's we call that visual field analysis.
Visual field analysis.
Yes. So for short, I'm sure your eye care providers will say go and do a CVF, a central visual field analysis. Yes. So it's a form of it's an investigation. It's not a treatment.
Okay.
So it's an investigation we do periodically. Yes, because these treatments, these investigations give us, they let us see the progression of this condition. Like your eye care provider can see, you can also see. It helps us to monitor.
In a chart.
Yes. So that is also done. Then there's the other one we call the optical coherence tomography. That gives us, we take, I don't know if you've done that soon, the OCT.
Talk about it, maybe
so the OCT is called the optical coherence tomography. Okay, so what the test does is to take multiple scans of this nerve. You know, ultimately the damage is to the nerve that lets us see. So this scan takes, test take multiple scans of the nerve and lets us see, what part is really damaged and how much damage has occurred. Yes, that is also done periodically for patients that have been diagnosed with glaucoma.
Okay.
Yes.
So when you say periodically, how often should you now visit your eye doctor?
Okay.
You know,
so for
management of this particular condition.
Okay, so for people who have not been diagnosed, whether you have symptoms or not, just go have your eyes checked yearly, at least once a year.
At least once a year.
Yes. So for people that have a family history of glaucoma, they should make themselves available for checks at least 6 monthly. Okay. So for patients who have been diagnosed and are on treatment, it depends. Okay. So we categorize patients with glaucoma as either early mild, moderate, or severe or advanced glaucoma. So depending on where you fall, your eye care provider would let you know how often you should come for your follow-ups.
Your routine checks.
Yes.
Okay. Again, I want you to restate this. Okay. Do all glaucoma diagnoses lead to permanent blindness, and why?
That is, if left untreated. Once left untreated, glaucoma ultimately leads to irreversible loss of vision. Yes, but once detected early and treatment is instituted, a patient can live their lives without going blind in their lifetime. Okay. So that is the importance of early diagnosis. Yes, that translates to early treatment, and that would now mean hopefully no loss of vision in a patient's lifetime. Okay. Yes.
This year's theme is Uniting for a Glaucoma-Free World. What does this call for in practical terms?
Okay, so it calls for awareness, okay? Like everybody should know, because in this present day and age, many people are still unaware, you know? So we all should
I think it's because it's symptomless. It has no symptoms.
Yes.
And people are just, since they can still go about their normal activities.
Yes. Yeah. Yes. So I would you take a minute to tell you an experience I had in the course of my practice, okay? So
we need to go on a short break right now.
Okay.
We'll continue this conversation when we come back.
Okay, thank you.
Ministry of Energy and Mineral Resources, Lagos State Electrification Agency, cordially invites the general public to the commissioning of electrical distribution towers crossing Baji, Lagoon, and rehabilitation of electrification infrastructures along Baji, Seme, and Owode-Akpa communities in the Badagry West Local Government Development Area, covering 37.7 kilometers and distribution transformers station. On Wednesday, 11th March 2026, time 11 a.m. Officially commissioned by Mr. Governor Babajide Olushola Sanwo-Olu, the Executive Governor of Lagos State. Announcer, Lagos State Electrification Agency. Ìgbéga ìpínlẹ̀ Èkó, àjùmọ̀ṣe gbogbo wa ni.
Went on that short break. We're talking about Uniting for a Glaucoma-Free World, and we have Dr. Anne Abang-Obi, Senior Registrar, LASUTH, and you know she was talking about the theme of this year, Uniting for a Glaucoma-Free World, and what does this call for in practical terms?
Okay, so it calls for more awareness. We should create more awareness so that more people are aware of this menace called glaucoma, mainly because it is usually symptomless at the initial stages. By the time a patient becomes aware that they can't see again, at that point, nothing can be done to bring back vision. So the key is awareness, early diagnosis, early treatment. Yes.
So who are the people who need to be part of this effort that you're talking about, aside the medical practitioners?
Every single one of us, media houses, the government, okay? Aside us, the healthcare providers, what do they call, entertainers. You can co-opt them to help, because many people listen to them. Yes, if they can create an awareness, they can use their platforms to create this awareness. It will go a long way, to reduce this burden.
Okay, now that every year there is this call for action, you know, and we just talked about people not going for this eye examination. Is it possible, have you been doing it that, okay, you now take this eye test to communities, you know, because it is only educated people, you know, that will go out themselves. The people in the communities will not go until, even with all this awareness, they will tell you it's not their business yet until they find themselves in that situation. So during this awareness week, during the awareness program,
Okay.
have you thought of going, taking it to the communities?
Yes. We do carry out outreaches at community level. Yes, we do carry out outreaches. So where we go, we screen, and then we refer those that need for appropriate care. And then we also counsel and create. We do meet people at the communities. Yes, but our coverage may not be that wide, okay, but we do carry out these
so
outreaches.
how effective has this been, how
really very,
how much have these people in the communities embraced this outreach?
Once they hear it's free, come and have your eyes checked for free.
They will rush out.
You see them showing up, yes. And then the good thing is, an individual gets screened, they tell the second person, who tells a third. So before you know it, they all come out. Yes.
Okay, now for Nigerians watching us right now, what simple steps can they take to protect their vision? Because, these days you see a lot of Nigerians,
Okay.
buried, burying their eyes in their phones.
Please, okay.
And computers and,
Okay, but I just need us to understand that these are not the causes of glaucoma.
Of course they're not.
Okay.
No,
okay.
Of course it's not.
Okay.
It's just for people to protect their eyes.
Yes, please. Yes, no prolonged screen times, not too good. Okay, and then if you have to, for people that have jobs that require you to be on the screen for prolonged periods, there are the blue cut photochromic lenses we recommend. Yes, so this will help reduce the amount of light entering the eyes. Yes, then for people that work in high risk areas, construction workers and all outdoor workers, we encourage them to wear protective glasses while at their duty post. So that way to protect the eyes from, their occupational hazards.
Okay, before we go, a final message for you concerning the Glaucoma Week.
Okay, so take advantage of this time. Your eyes will be screened for free. Walk into most of the tertiary or even the secondary eye health facilities and have your eyes screened for free this period. Yes.
Tertiary, please break it down.
Okay.
Break it down.
Okay, so by what I mean is, even at the community level, we have primary health centers there. Yes. So the primary health centers at your communities, please go there this week and have your eyes screened for free. For free. Yes,
it is free.
Please. Even the general hospitals around you. Yes, there are many general hospitals around Lagos. Within Lagos. So go there and have your eyes checked this week for free. Then we have the tertiary institutions, the Lagos State University Teaching Hospital, then the Lagos University Teaching Hospital. You can go there for free this week and have your eyes checked. After this week, you might have to start paying for the services, but take advantage of this opportunity. Yes.
Thank you very much, Dr. Anne Abang-Obi, Senior Registrar, LASUTH, and we've been talking about the theme for this year, Uniting for a Glaucoma-Free World. Glaucoma might be silent, might be symptomless, but its impact is life-changing. And as Doctor said, do go for your eye screening, especially now that, they're having the Glaucoma Week, so that you can get your eyes tested for free. Please, it is very, very important. Do not leave this so that you don't get blind. You won't know if you don't get your eyes tested. Please get your eyes tested. Thank you very much, Doctor. We'll go on a short break. When we come back, the conversation continues.